The following program has been furnished and paid for by Ask the Expert Show. KSEV is not responsible for its content or the products or services offered. Welcome to the Ask the Expert Show with local experts in the field of health, legal, financial, and home improvement. Now, here's your host, Gary Knight.
Hope your weekend is going great. This is called the Big Thaw Out. We're getting into the warming trend. I hope it stays like this. Welcome again. I'm the aforementioned Gary Knight. This is a weekend, and it's time for Ask the Experts. And today, we got quite a few shows in business. And we're going to start off with FESA. And Harlan's standing by. That's the Federal Employee Service Association.
There you go. That's
FESA.
all right.
All right. And you've been with FESA for how long, and what made you get into it? I'm very curious when I ask these questions to people.
Yes, sir. I have been working with FESA since 2008.
Okay.
They have specialized in helping federal employees primarily since that time understand their benefits. And that's across the whole spectrum of benefits, both how they can retire, what they have as really the wonderful suite of benefits that the federal government offers. The problem that they face is they don't have anyone to explain it to them. Back in 2007, the government changed the way that they handled their human resources, and those folks have no one to answer their questions now. FESA was able to step into that gap, and we provide what's called a free benefits analysis, help people understand what benefits they have, and it's amazing, Gary, how many folks you find that are paying for benefits they absolutely could not use, cannot use. It would be impossible for them to get the benefit because of changes in their life, and it is on their pay stub and comes out every single pay period, and they have no idea what it is.
So you help anybody, right? Tell us more about the FESA. Tell us more about the company.
Yeah, that's right. So we started in 2008 helping feds, and we really saw a big need over time in the private sector also.
Okay.
What we would really find is a lot of referrals from the folks that we had helped that their brother-in-law, worked for Halliburton or worked for someone else that had the same situation, just didn't understand what benefits that they had. And we stepped into that gap and helped them understand those, even though they were in the private sector. Once we started getting more and more into that, we realized, wow, there is a huge number of people out there, whether they work for someone else or work for themselves, that simply don't understand the benefits that are available. And in 2017, we really started working hard towards getting those folks in the private sector to take the time to sit down to understand the benefits that are available to them.
So FESA, you're working with Social Security, correct?
That's correct, yes, sir.
Pensions, IRAs. I mean, you got everything going.
Right, because that's all the benefits, right? A lot of folks don't even look at Social Security as a benefit that they have any control over. But, Gary, there are tons of things that you can do as an individual that help you control what your Social Security is going to look like when it's that time. When you decide to take that benefit, it really, I cannot stress enough how big an impact. We're talking about the difference in hundreds of thousands and even millions of dollars over your lifetime that you can lose or gain by the decisions you make.
So
for
FESA
Social Security
fills the void in the marketplace.
Absolutely,
Okay.
Yes, sir.
Now, I heard you mention Social Security maximization. Now, what is that? And it's a two-parter. And how can they possibly have any control over how much Social Security income that they receive?
That is a very personal question. And what I mean by that, Gary, is that each person is different. That is why we actually offer a free Social Security maximization report to each and every person that requests one from us. What we look at is your age. We ask you a lot of questions. So we look at your age. We look at when you may be eligible for that. We look at what you have contributed at this point. And everyone gets that statement. And it's amazing to us, Gary, how many people don't get it or haven't seen one in 10, 15, 20 years.
Really?
Maybe don't even have an account with Social Security. It really is one of those things that I think people just forget about to a certain degree. You know, there's a lot of misinformation or myths out there about Social Security that, oh, it won't be there whenever I retire anyway, so why should I worry too much about it? That's just not true. There's always going to be Social Security, and you need to do what it takes. Take the steps to make sure you're doing it right. There are times whenever it makes more sense to get on your spouse's benefit. There are times when you may qualify for a deceased spouse or a deceased someone you've been divorced from for 20 years. You may qualify to get their benefit, and you didn't even know it. And it's amazing how many people are shocked. I have sit in a classroom with folks and told them this, and we then did a maximization afterwards, and guess what? They realized they could retire.
Really?
Right now.
Wow.
And they were as shocked as you are right now. They couldn't believe the benefit that was sitting there, and they could have been retired 2 or 3 years even before that.
I'm 72. I'm still working. I have my own health through the company.
Okay.
Somebody that did it already that works here at the same station went into Medicare rather, and he's saving like 40% on the stuff that, I'm not knocking up. It's a lot cheaper in the long run. I think it is. My question to you would be, if I'm going to get 40% off what I'm paying per month, wouldn't it be better to get into Medicare while I'm working, or should I stay where I'm at?
It's a very interesting question, too. Not everyone is. In your case, you may be. The only way that we can know is to sit down and do an analysis of your current situation, Gary.
Okay.
There are a number of people that I recommend go to Medicare and either a Medicare Advantage or a Medicare supplement plan. And many people, many, have great plans at work. And I say, you stay right where you're at until you retire. Then we look at it again. But it really depends on how your plan itself works and who all you're covering.
Different situations.
Right. That's exactly right. Because if you have family on your plan and you leave it, they could be without benefits, Gary. And I mean, they won't be too happy about that.
Exactly. Now, there's a lot of questions that I'm asking. We're going to be asking you more questions on the air. But everybody that are listening and interested, because this is a confusing time anyway. It's a crazy world. You can contact FESA today. And I'm going to give a number. You tell me this is the correct number. 512-687. Am I doing right so far?
Yes, sir.
6202.
Yes, sir.
Or go FESA.com.
That's right.
That's all you need, right?
That's correct.
24/7, you can get a hold of somebody, or should you wait during a certain time to call? Or
24/7, yes, sir. They can also find us on Facebook, Instagram, or Twitter at Team FESA.
Very good. Now, I see on your website you help federal employees and the private sector. What's the difference between the two?
Well, as we mentioned earlier, Gary, it is the feds kind of have their very set benefits, a great suite of benefits. They make it very confusing, so a lot of times folks don't really understand what they have. But if you get into the private sector, each company gets to choose benefits.
All right.
So you're talking about federal workers, there's 4 million plus that have almost the same benefits across the board, although there is variations of that. But look at all the millions of different companies that you have across the country, and they get to choose the benefits or lack thereof that their employees have. One of the things that I think we see most of all in the private sector is that employers, no matter their size, want to provide some level of benefits to their employees, but many times they don't know where to start, and they also believe that it will be way too costly for them to offer those benefits. Well, I'll tell you this, Gary, I think in today, we're in the middle of a pandemic, right?
Yeah, right.
It seems to me like it'd be too costly for them not to offer those benefits, Gary.
Makes sense to me. You're talking about offering health insurance to, say, for instance, their employees. Now, do they have to wait for open employment for that?
Open enrollment.
Okay.
Right. And
when is open enrollment? Just the same date, same year? See, I'm asking, no questions stupid, but I'm asking questions that people are asking.
Absolutely. Yes, sir. And here's the cool thing about being an employer. You decide when open enrollment is.
Okay.
Right. That's what's great. Whereas you have Marketplace or you have Medicare, you have those times that there are certain open enrollment periods.
Right.
But guess what? If you're an employer and you offer a plan to your folks, you decide when open enrollment is. And that can be any time during the year. We all traditionally think of it near the end of the year, right?
Yeah.
Well, it doesn't have to be that. If you decide you want to have open enrollment in May, you have open enrollment in May.
Well, that's my kind of thing. Why doesn't my doctor accept health insurance anymore? Is that a political thing or?
It's a money thing.
Okay.
Let's be honest. It's a money thing. They have to hire so much staff to manage all of the insurance claims, the Medicare claims, the Medicaid claims. It just gets so unwieldy that many doctors have changed to no insurance, or they've even changed to what's called a direct primary care model, and they just got away from it. And I'll tell you, if you see a doctor that is in that realm, you will likely get better care. And here's why. They have to see so many people, Gary, so many people. They have to have this churn of people that they see to make sure that they make ends meet. When is the last time you had a doctor spend 30 minutes with you to make sure that everything that's going on with you, he understands?
30 minutes?
30 minutes, yes, sir.
No way.
No
You
way.
better write your questions down, because you don't, he's going to be in and out in 7 or 8 minutes, or maybe less.
Or maybe less. That's exactly right. A lot of times they've already predetermined what's wrong with you, right?
Okay.
Yeah, the nurse come in and saw you, took down all the information, put it all in, and they walked in. They said, yeah, it's this. They wrote you a script and they walked out.
Exactly. You're right.
Very common, especially in the doc in the boxes, as we like to call them, whether you got your little med clinics and your urgent cares and such. Very common that it happens there. But you're certainly not getting the care that you deserve and that you need. So many things that can go wrong in your life are because the doctor didn't spend the time with you and you don't have that relationship. Remember, we used to hear all these great stories of not doctors just coming to the house, making house calls.
Oh, I remember those days, way back.
Yeah, I can remember my mom having this great relationship with the doctor, talking about when there was things going on, and even us as kids, they were able to call and talk about different things. And the doctor would let you know if you needed to come in. Well, we have Teladoc now for that, but guess what? That doctor still doesn't know you. Teladoc is great, and it has been utilized to the nth degree over the past year because of the pandemic. It's been a lifesaver for many people because they were able to get the prescriptions or the care they needed without having to face the pandemic as far as going into a clinic and being scared to be there.
Thank heaven for that.
You're right. And so we've seen a huge increase, about 800% increase in Teladoc, and it's here to stay. And I really am happy that it is, because I think there's some great things that can happen there. But the alternative to never seeing your doctor is not the answer either, because there is nothing like that face-to-face interaction of having your doctor and making sure that y'all are on the same page.
A lot of people are still afraid to go to the doctors right now during these times, and that's causing problems right now.
Absolutely it is. It's become a big enough problem that we are seeing lots of doctors go out of business too. Did you know we've lost about 8% of our primary care doctors across the country? Over 16,000 primary care offices have shut their doors.
Due to the virus?
Due to the virus.
Where are they at? Where did they go?
Exactly. They go to work for other practices. They get out of the medicine business completely. And guess why? They can't keep their doors open because they can't see. If no one's coming in, Gary, how can you keep your door open, right?
Exactly. These are the difficult times that we're facing right now. What are my options to access my 401k? Do I have an option?
Well, I'll tell you, that's a loaded question, because as I mentioned earlier, that anything to do with your finances like that is definitely a very personal question. It is something that you need to look at with someone to take the time to find out if it's the right move for you, period. The 401k, of course, is designed for what? Your retirement.
Right, exactly.
And if you are accessing those funds, you're accessing your retirement funds. You're having definitely a negative impact on your retirement. Now, let's also look at it in a more realistic way and say, yeah, but I haven't worked in 6 months. The bills are due. I have this $100,000, $200,000 sitting there. Why can't I utilize that right now?
Yeah, why can't you?
Well, you can.
Okay.
Will there be some implications there? Yes, there will be. One of the things that changed with the CARES Act last year was that you were able to access about $100,000 of that money without that 10% penalty. And if you paid it back over 3 years, you didn't have to even have the tax implications on it, or you get to spread the taxes over 3 years. Well, that ended on the 30th of December.
For everybody.
For everybody.
Okay.
Now,
go ahead.
The COVID, there's another COVID tax relief that they passed that has some similar benefits to it, but once again, it is very personal. You need to talk to somebody about your situation and find out if it is a good move for you. My personal belief is that money is there to help you, whether it's retirement or now. If you need that money, you want to make sure that you access it in the best way for your family and for your future. So I would highly recommend that if you're thinking about accessing your 401k, 403b, whatever, your IRA, any of those retirement, that you reach out to us at GoFessa and GoFessa.com, and you go ahead and set up a personal benefits analysis so that we can review that information with you and make sure that you're making the best choice.
Let me go step back just a little bit.
Okay.
I don't think you mentioned it. If you did, we'll move ahead. You can say, shame on you, Gary. So it doesn't bother me. But who put this whole thing together, and when did this start? 2000 something?
Yeah. As we mentioned,
2008. You mentioned
right. 2008.
A bunch of people with their experience, financial and everything, got together and put this together, saying we're going to give them everything, because there's a lot of things that they don't need to pay for, or they are not paying or not using, and they're still paying for them.
Absolutely.
Right?
Absolutely.
That's all we need. And I'm going to go right back over here because I got an important question. All the great things, all the great options that you've been giving us here today, and all the great services. How do you get? How do they get them for free? I mean, it's amazing. You guys, this is all free, and you're getting all these things now. Am I getting this correct?
Yes, sir.
Okay.
Yes, sir. All the advice that we provide, all of the consultations are at no cost. One of the things
how do you provide? How can you do this?
Right, because there are times when the services that you need will be a product that will provide us a commission. Straight out. Okay. If it is a product that, let's say that a life insurance product is what works for you, Gary, it's going to be the best for your needs when we sit down and talk about it.
Okay.
Well, that life insurance company is then going to pay us. You'll never pay us a penny, but that life insurance company will. If there is nothing that we can do for you but give you advice, send you on your way, provide you that Social Security maximization report, there will never be a cost for that. And if there's nothing else we can do but give you that advice and send you on your way and say, good luck, we wish you the best, and don't forget you can call us back at any time, there will still be no cost to you for that.
512-687-6202. Call Fessa today, or you can go Fessa.com. Either way, you go either way with that one, right?
Yes,
it doesn't
sir.
really matter either way.
That's right.
Okay. And how long does it take to get back with them?
We'll get back to them, right away. They're going to get somebody, and they're going to have somebody call them back or reach back out to them virtually immediately.
Okay. Is it pretty busy nowadays? Or it probably has a steady stream, I would imagine.
A very steady stream.
Well, so these baby boomers are still getting, we're just finishing the last tail end of them now, but we're here. We're 70 plus strong.
That's right. And remember, a lot of those folks still haven't retired, Gary.
Wow.
They haven't retired. They, for whatever reason, and it is amazing to me still how many people could have retired and just didn't realize the benefits that they had available to them.
Now, you're talking about retirement. Okay, this person's ready to retire. Here's a good question for you. But his company does not offer health insurance to retirees. You probably heard that many times before.
Absolutely.
Everything I have looked at is expensive and would take up to too much of my retirement income. What are my options?
Very good question. It's very similar to what you asked earlier, but here's the difference. You're still offered something through your company. A lot of times folks that get on Medicare or retire, they're not. So if they're not Medicare age, there is some options on the marketplace that may or may not be good for them, but there are also options out there such as Eagle Care Health Solutions. One of the many things that Fessa has done to help folks in the private sector is develop Eagle Care Health Solutions. Now, what this plan is it is a multi-tiered health solution that gives you coverage for everything from those doctor's visits we talked about.
Okay.
You have even HSA options. You have copay options. You have direct primary care. You have all of these different tiers of coverage that you have available to you. And here's what's really awesome about that too, Gary, is that it's offered to employer groups of 2 or more. The big deal is that it's going to be 40 to 60% less than what you're getting from your Blues, your Uniteds, your Humanas, all of those guys out there. You're going to have a huge decrease in that cost. It is one of those options that I mentioned earlier that a lot of employers don't realize. They can offer great benefits to their employees, but they have no idea what all is available.
Very interesting. Harlan, last name, Harlan? Can you give it out?
Pickett, yes, sir.
Harlan Pickett. Here's a self-employed question.
All right.
This person's self-employed, does not have a lot of extra funds to set aside. I've heard that before.
Yeah.
Is there really anything out there that would make a difference for that retirement of his or hers?
Very good question. So let's think about that just for a second. If they had a personal benefits analysis done, one of the things that we find many times when that happens is we find extra funds that they didn't even realize they had.
Okay.
Now, all of a sudden, it changes the dynamic of what they have available to put towards retirement. But let me ask you a question, Gary. This is very, very important to think about.
Okay.
If you never start putting money aside, no matter how little, will you ever start? You got to start somewhere, right? If it's $25, that's better than no dollars, right?
Oh, yeah, sure it is. I was just thinking why the pause, because I didn't start from the beginning. There's a lot of young kids doing that now. I feel great about that. I said, I'll save a bit. Yeah, if you don't, sometimes you don't.
That's right. You keep waiting until you make enough.
Exactly.
Right? You keep waiting until you make enough extra. But guess what? The more you make, the more you
spend.
The more you spend.
There
so
you
you
go.
keep wondering why you don't have any extra money, although you keep getting raises, but you never put any extra money aside, and you keep wondering what's going on. But if you start saving, no matter how much.
Discipline.
That's right. But if you start saving something, and every time you get a little kick in that income, you put a little more part of that away, all of a sudden you're going to realize, wow, I've got a whole lot more there than I thought. And you never know which product is going to be the best for you or which type of savings. Well, now, we know how much a savings account is going to pay you right now, right? Yeah, 0.0000. Okay, obviously I'm being a little facetious there, but there's a lot of zeros before you get to any numbers, before you get anything from that savings account. But there's a lot of great products out there. You can look at Ross, you can look at traditional IRAs, you can look at any number of things that may help you down the road. But until you start saving, I know this is just as goofy as it sounds. You talk about being corny. Until you start saving, you haven't started saving.
Exactly. It's common sense, right?
It is.
My family cannot afford health insurance, this goes on to say.
Okay.
Every year it gets more expensive and covers less. Oh, yeah. Are there any affordable options out there that actually cover anything?
Well, that is a great question. You know, we talked a little while ago about people not going to see the doctor. And one of the biggest fears that I hear right now are people that say, well, yeah, all I can afford is a high deductible plan.
Yep.
A high deductible, my deductible is $8,550. Why would I go to the doctor when I have no idea what that bill is going to be? I'm terrified that I'm going to have a $300, $400, $500, $600, $2,000 bill. Now what am I going to do? Well, that is a very common situation. Very common that people are afraid to go to the doctor. And because there are direct primary clinics available now, because there are some wonderful health share programs out there, and obviously the program that FESA has put together, Eagle Care Health Solutions, we're bringing affordable and sensible solutions to the marketplace so folks can get the coverage that they truly want and deserve and not have to break the bank doing it. Plus, they'll have an idea of what their costs are going to be when they go to the doctor. And what we really want to promote is wellness, and of course, we want to promote that relationship with your doctor so that you really, truly have an idea of what's going on. Instead of someone seeing you for just a minute, writing down some notes saying, yeah, I'm going to write you this, and it's going to take care of it. It's going to take care of what, Doc? I don't even know what's going on.
Exactly. We got about a minute and a half, and I heard you mention just a little earlier about direct primary care. What is that?
Direct primary care is a direct relationship with a physician. It is really an up-and-coming option for many folks One of the options, obviously, that we offer on Eagle Care.
Is it rather new to the marketplace?
It's been around for a
Decade or
number of, correct, but it's just now really flourishing. And it's because of so many people turning away from insurance. It's because of folks that just don't have that relationship with their doctor anymore and they're tired of it. It's just a great option. Very great option. Direct primary care is here to stay. And if you really want to have a relationship with your doctor, make sure you guys are on the same page with everything, then I highly recommend you look at it as an option.
Thank you, Harlan, for everything. Well, this time went quick as usual. And if they want some more answers, the questions that they have of their own, contact Fessa today, 512-687-6202 or gofessa.com.
That's it.
Thank you very much. Have a great weekend.
Yes, sir.
Ask the Experts with Gary Knight here on AM 700 KSEV.
Thanks again for tuning in for another Ask the Expert show right here on AM 700 KSEV.